So today I'm going to show you how to set up a standard and an augmented TSA for a case that we would do with Dr. Bailey. Right here, these three trays, we have your humeral preparation stuff. So for today, I'm going to set up for a small. We're going to start by going in our Flex Common tray. For the small patient, we'll grab the size 1 and 2 or the 3 and 4 planers. We're going to grab the small white screwdriver, small and medium cut protector. We'll base this off of the resection size of the humeral head. We'll grab our slap hammer. We're going to grab this big guy, our tenaculums, and our impaction block. This is going to be our tray for broaching, so preparing the humeral canal for the stems. We're going to grab our version rods. We have our canal finder. This is going to start the canal. And then with these, we are going to, these are sounders based off of if it's planned or if it's unplanned. You're going to go down. This basically just tells you the size of the canal to see what is the largest possible stem that can fit. So going to the bottom here. As you can see in here, we have our stems. We have our standard short stems, and we also have our long stems. We're going to be doing our short stems. So we will grab, for a small patient, I would recommend grabbing maybe up to 5, depending on if it's planned or not. So with these, you'll take this hex driver and you can lock it at any inclination you want. We have A, B, and C. I don't know if you can see on the back here. There's A, B, and C. For today, we'll lock them at B. So what you do is you can kind of set it how you want. It will not lock in between. So you don't have to worry about, getting it stuck. If you want to go A, you can go all the way down one way, C all the way the other way. With B, I recommend you can base off the back line, it'll line up. But the easiest way to do it for a scrub is to make sure that there is space on both sides. And then you can lock it down. Just like that. You can see we got space on both sides right here, and that stem is locked at B. So we'll go through, you'll lock all the stems at the desired angle for the surgeon. For Dr. Bailey, he likes his locked at B. These will go onto, these are our broach handles. With the broach handles, you'll pop open the handle, you will take the stem, and these 2 feet will put right in those holes, and it'll lock in like that. Boom. See how it's locked? It won't move. This, we will take our version rods for this. It depends on if your surgeon wants them on the sounders or wants them on the broach handles. Dr. Bailey doesn't put them on the sounders, but he goes off the broach handle. And then you can put it in your desired version right here. So we will put it at 30, which is right there. And then you can also see on the handle up here, there's an L for a left shoulder and there's an R for a right shoulder. So we'll set up for a left total shoulder. There's one, here's the other one. We'll set up size 2. And the other version rod is right here. So we'll put this into 30 degrees. And then if you need bigger sizes, you can go back, you can either pull them, you can go back into the tray, whatever you need to do. Over here, we have our trial soft tissue balancing heads. We have anatomic heads as well. The soft tissue balancing heads are, the blue are going to be low offset, which is 1.5 millimeters offset, and the black are going to be the high offset, which are 3.5 millimeters. The difference is, with the STB, you get the offset, but you also get more sizing options. So for small, we'll just take, not that one. we'll go with the 42 by 18 low offset head. Now, over here, we have our TSA. This is for the standard TSA. It's going to be these two trays right here. And then over here we have for the Augment, which we will get to after. So we have our handles here. These will go into the chip faces. With the chips, we have the different backside radiuses of curvature. So you can see there's a S30, S35, S40. So it's 35 or 30, 35, 40 for the backside radius curvature. Under those, you have the same backside radius of curvature for the reamer heads under the chips. So we will do the 0 degree with the handles. There's a 0 degree, there's a 5 degree, and a 10 degree. So you can actually put the chip on, put it up to the Glenoid, and that'll correct inversion just based off of shooting your pin with the handles. So we're gonna do a small 40. So you'll take the chip with the 0 degree handles, what we're using, and it'll go directly into the face, just like that. So this is what we'll use. This will be what they'll shoot their pin through. You can also use these paddles right here. If you look at the paddles, we have, this is how you can actually measure your backside radius of curvature. So we have, this is what you would do inferior superior. So you'd put it, inferior superiorly. And then on the other side, it's anterior posterior. So you would hold it anterior posterior. So there's those. We can pull these. Then we can grab this handle. We can grab, we don't need that guy. There's different types of